Hello, I'm Dr. Vasconcelos. In today's video, we're going to talk about a silent and often overlooked sign that appears on elderly skin when death is near. It's subtle, but incredibly important. And sadly, most families don't recognize it in time. Stay with me until the end because understanding this could make all the difference in your loved one's final moments. And if you care about the health and well-being of those you love, make sure to subscribe to the channel right now. Your attention could truly save a life.
Have you ever noticed strange marks appearing on your elderly loved one's skin that seem to come from nowhere? What I'm about to reveal might shock you, but it could be the difference between life and death for someone you care about. I'm Dr. Vasconcelos, and in my 30 years of medical practice, I've witnessed countless families miss the most important warning signs that appear right before their eyes. Today, I'll share with you the hidden language your skin speaks when death approaches. Knowledge that could save lives if you know what to look for. The human body is an incredible machine that communicates with us constantly, especially during our final stages of life. But here's what most people don't understand. The skin, our largest organ, becomes a roadmap of internal changes happening deep within our bodies. When vital organs begin to fail, when circulation slows, when the heart struggles to pump blood effectively, your skin tells the whole story. Yet families often dismiss these signs as normal aging, missing crucial opportunities to seek help or provide comfort. What makes this even more heartbreaking is that these skin changes often appear weeks or even months before other obvious symptoms. While your loved one might still be talking, eating, and seeming relatively normal, their skin is already showing clear evidence of what medical professionals call the dying process. These aren't random age spots or simple bruises. They're specific, predictable patterns that follow the body's systematic shutdown. The medical community has studied these phenomena extensively, yet this knowledge rarely reaches families who need it most. We talk about advanced directives and end-of-life care, but we forget to educate people about the physical signs that herald these difficult times. This creates a dangerous gap where families remain unaware, unprepared, and unable to make informed decisions about care. But here's what almost nobody knows about these skin changes. They don't just predict death, they can actually help us understand what's happening inside the body, and sometimes even guide us toward interventions that might extend life or improve comfort. The key is knowing exactly what to look for and understanding what each sign really means. And I promise you, by the end of this video, you'll have knowledge that could change everything for you and your family. The first sign that appears on elderly skin is something called mottling, and it's far more significant than most people realize. Picture this. You're visiting your elderly parent or grandparent, and you notice their skin has developed a blotchy, lace-like pattern of red and purple patches, especially on their arms and legs. Most families think this is just poor circulation or cold weather, but what's actually happening is profound and requires immediate attention. Mottling occurs when blood circulation becomes severely compromised, typically indicating that the cardiovascular system is beginning to fail. The heart can no longer pump blood efficiently to the extremities, causing blood to pool in certain areas while leaving others pale and cold. This creates that distinctive patchy appearance that looks almost like marble or a fishing net pattern under the skin. Medical research shows that when mottling appears, especially in the lower extremities, it often indicates that death may occur within days to weeks. But here's the critical part that families miss. Mottling doesn't just appear randomly. It follows a specific progression that can help you understand the severity of your loved one's condition. It typically starts at the feet and ankles, then gradually moves up the legs. When it reaches the torso, particularly the chest and abdomen, this indicates severe cardiovascular compromise. The pattern becomes more pronounced and widespread as circulation continues to deteriorate. What makes this even more important is that mottling can sometimes be reversible in early stages. If you notice these patterns and seek immediate medical attention, healthcare providers might be able to improve circulation through medications, position changes, or other interventions. However, once mottling becomes extensive and reaches the central body areas, it usually indicates irreversible changes. The temperature changes that accompany mottling are equally significant. Areas of mottled skin often feel cool or cold to the touch, while other areas might feel unusually warm. This temperature variation reflects the uneven blood flow and can cause discomfort for your loved one. Understanding this helps families provide better comfort care, such as appropriate blanket coverage and gentle warming techniques. If you're watching this and recognizing these signs in someone you love, don't panic, but don't ignore them either. Make sure to hit that like button if this information is helping you understand something important, because what I'm about to reveal next about color changes will give you even more crucial insight into what's happening inside the body. The second major skin sign that families consistently overlook is the dramatic color changes that occur in the face, particularly around the mouth, nose, and fingertips. This isn't just paleness. It's a specific blue or grayish discoloration called cyanosis, and it tells us exactly what's happening with oxygen levels in the blood. When you understand this sign, you'll never miss its significance again. Cyanosis occurs when blood oxygen levels drop below normal ranges, typically below 90% saturation. In healthy individuals, hemoglobin in red blood cells carries oxygen and gives blood its bright red color, which shows through the skin as a healthy pink hue. But when oxygen levels decrease, hemoglobin becomes darker, creating that blue or purple tint you might notice, especially in areas where skin is thinner and blood vessels are closer to the surface. The progression of cyanosis follows a predictable pattern that's crucial for families to understand. It usually begins around the lips and under the fingernails, areas called peripheral cyanosis. This early stage might indicate circulatory problems or mild oxygen deficiency. However, when cyanosis spreads to central areas like the face, chest, or tongue, this represents central cyanosis, a much more serious condition indicating severe oxygen deprivation that affects vital organs. But here's what almost nobody tells families. The timing and extent of cyanosis can actually help predict survival timeframes. Peripheral cyanosis that comes and goes might indicate hours to days of remaining life, while persistent central cyanosis often suggests hours to a day or two. Understanding this timeline helps families make critical decisions about gathering loved ones, having important conversations, or adjusting comfort care measures. What makes cyanosis particularly challenging for families is that it can be subtle at first, especially in individuals with darker skin tones where color changes are less obvious. Healthcare professionals are trained to check areas like the inside of the mouth, under the tongue, or the nail beds where color changes are more apparent regardless of natural skin pigmentation. Families should learn to look in these same areas rather than relying only on overall skin appearance. The emotional impact of watching these color changes can be overwhelming, but knowledge brings power and peace. When you understand that cyanosis reflects the body's natural process of conserving oxygen for vital organs like the brain and heart, it becomes less frightening and more understandable as part of the dying process. And there's something else about skin temperature changes that most families completely miss, something that could help you provide much better comfort during these difficult times. Temperature regulation becomes dramatically altered in the dying process, creating skin changes that tell us exactly how the body is redirecting its remaining energy to vital organs. What families often interpret as fever or feeling cold is actually a complex physiological process that, when understood properly, can guide better care decisions and provide insight into timing and comfort needs. During the active dying process, the body's thermostat essentially breaks down. Normal temperature regulation requires significant energy and coordination between multiple organ systems, including the brain, circulatory system, and metabolic processes. As these systems begin to fail, you'll notice that your loved one's skin becomes increasingly cool, starting with the hands and feet and gradually moving toward the center of the body. This isn't just poor circulation, it's the body's intelligent response to conserve energy for essential functions. The pattern of cooling follows what medical professionals call peripheral shutdown. Blood flow is redirected away from extremities and non-essential areas toward the brain, heart, and other vital organs. This means that while hands, feet, arms, and legs become noticeably cool and sometimes even cold to the touch, the core body temperature might remain normal or even elevated. Families often make the mistake of trying to warm these cool extremities with heating pads or excessive blankets, which can actually cause discomfort. But here's the crucial detail that changes everything. The timing of these temperature changes provides valuable information about the dying process timeline. When cooling is limited to hands and feet, this might indicate days to weeks of remaining life. However, when coolness extends to the arms and legs, we're typically looking at days to hours. When the trunk of the body becomes cool, death usually occurs within hours. What's particularly important for families to understand is the concept of false fever that often occurs during dying. As the body's temperature regulation fails, some individuals experience periods where their core temperature rises, making them feel hot and sweaty, even while their extremities remain cool. This can be confusing and distressing for families who might interpret this as a sign of infection or improvement, when it's actually part of the natural dying process. The skin texture changes that accompany these temperature variations are equally significant. Cool areas often develop a waxy or translucent appearance, while areas experiencing false fever might become flushed or develop a mottled red appearance. These texture changes reflect alterations in blood flow and cellular function that are part of the body's systematic shutdown. Have you ever noticed these temperature changes in someone you cared about and wondered what they meant? If this information is helping you understand something important that happened in your family, please consider subscribing to this channel, because understanding these signs can bring peace and preparation during life's most difficult moments. But what I'm about to share next about changes in skin elasticity and texture might be the most overlooked sign of all. Skin elasticity and texture undergo profound changes during the dying process that most families completely miss, yet these changes provide some of the clearest insights into internal organ function and timeline. When you understand what's happening to skin structure during dying, you'll recognize signs that could help you provide better comfort and make more informed decisions about care. Normal healthy skin maintains its elasticity through adequate hydration, proper circulation, and cellular renewal processes. When you pinch healthy skin and release it, it immediately snaps back to its normal position. This skin turgor test is something medical professionals use to assess hydration status and overall health. But during the dying process, multiple factors combine to dramatically alter skin elasticity in ways that tell us about kidney function, circulation, and cellular breakdown. As organ systems begin failing, the body's ability to maintain proper fluid balance becomes severely compromised. The kidneys, which normally regulate fluid retention and elimination, begin to function less effectively or shut down entirely. This creates a complex situation where some individuals develop fluid retention in certain areas while simultaneously becoming dehydrated in others. You might notice swelling in the legs, abdomen, or face, while the skin on arms and hands becomes loose and tent-like when pinched. But here's what's really happening beneath the surface. Cellular breakdown accelerates during the dying process, affecting the proteins and structures that give skin its normal texture and appearance. Collagen and elastin fibers begin to deteriorate more rapidly, while decreased circulation reduces the delivery of nutrients necessary for maintaining skin integrity. This creates that characteristic paper-thin, almost translucent appearance that many families notice but don't understand. The progression of these skin texture changes follows predictable patterns that can help families understand what's occurring internally. Early changes might include slight looseness or decreased elasticity in the hands and face. As the process continues, skin becomes increasingly fragile, tears easily, and develops that characteristic parchment-like quality. In advanced stages, skin might become so fragile that normal activities like repositioning or gentle touch can cause tears or bruising. What makes these changes particularly significant is their relationship to internal organ function. Skin elasticity directly reflects hydration status, which tells us about kidney function, heart function, and overall fluid balance. When skin remains tented for several seconds after being gently pinched, this indicates significant dehydration or organ dysfunction that might require immediate medical evaluation. The high emotional impact of watching these changes can be particularly difficult for families, because skin texture changes make loved ones look different, sometimes dramatically so. Understanding that these changes are part of the body's natural process of redirecting energy away from non-essential functions can help families focus on comfort and presence rather than distress about appearance changes. And there's something even more subtle that appears on the skin during dying that most families never notice: something that could help you understand exactly what's happening with vital organs. Bruising patterns during the dying process reveal critical information about blood clotting function and internal bleeding that families rarely recognize as significant warning signs. These aren't ordinary bruises from bumps or falls. They're spontaneous bruises that appear without trauma, often in specific patterns that tell us exactly what's happening inside the body with blood vessels and clotting. Mechanisms. Normal blood clotting is a complex process involving multiple factors, including platelets, clotting proteins, and proper blood vessel function. During serious illness or the dying process, several factors can disrupt this delicate balance. Liver function might deteriorate, affecting the production of clotting factors. Platelet counts might drop. Blood vessels might become more fragile. Medications might interfere with normal clotting. The result is spontaneous bruising that appears. In characteristic patterns, these bruises typically start small and might initially look like tiny red or purple spots called petechiae. Families often dismiss these as age spots or minor skin irritation, but petechiae specifically indicate problems with platelet function or blood vessel integrity. As the condition progresses, these small spots might enlarge into larger bruises called purpura, and eventually into extensive bruising that can cover large areas of skin. But here's the crucial pattern that families need to recognize. The location and progression of spontaneous bruising provides valuable diagnostic information. Bruising that appears first on the lower legs and gradually moves upward often indicates problems with circulation and blood vessel integrity. Bruising around the eyes, mouth, or on the torso without trauma suggests more serious internal bleeding or severe clotting dysfunction. What's particularly important is understanding the timeline these bruising patterns suggest. Small petechiae that appear and disappear might indicate days to weeks of declining function. Extensive purpura or large spontaneous bruises often suggest days to hours of remaining life, especially when combined with other signs like mottling or temperature changes. The medical significance of spontaneous bruising extends beyond just timing. It can actually guide treatment decisions. In some cases, identifying severe clotting dysfunction early might allow for interventions that could extend life or improve comfort. However, in end-stage situations, understanding that bruising reflects the body's natural breakdown can help families avoid unnecessary invasive procedures and focus on comfort care. For healthcare providers and families, documenting the progression of spontaneous bruising provides valuable information for care planning. Taking photos of bruising patterns can help medical teams assess how quickly changes are occurring and adjust care plans accordingly. This documentation can also help families understand the timeline and make informed decisions about gathering loved ones or adjusting goals of care. The emotional challenge of watching spontaneous bruising develop is that it can make loved ones look like they've been injured or are in pain, even when they're comfortable. Understanding that these marks reflect internal processes rather than external trauma can help families focus on providing presence and comfort rather than distress about appearance. If you're recognizing these signs in someone you love, remember that knowledge brings power to make informed decisions. Consider sharing this video with other family members who might need this information, because what I'm about to reveal about changes in skin sensation and response could change how you provide care during these crucial times. Changes in skin sensation and response to touch during the dying process provide profound insights into nervous system function and can dramatically impact how families provide comfort care. What most people don't realize is that the skin's ability to feel temperature, pressure, and pain undergoes systematic changes that follow predictable patterns, and understanding these changes can help you provide much better end-of-life care. The nervous system's response to dying follows a specific progression that affects skin sensation in measurable ways. As circulation decreases and organs begin shutting down, nerve function becomes compromised. Starting with the longest nerves first. This means sensation changes typically begin in the feet and hands, gradually progressing toward the center of the body. You might notice that your loved one doesn't respond to gentle touch on their feet or hands, while still being sensitive to touch on their face or torso. But here's what families often miss. Decreased sensation doesn't necessarily mean decreased awareness. Many individuals who appear unresponsive to touch in their extremities can still feel pressure, temperature changes, or positioning discomfort in central body areas. This is why proper positioning, gentle repositioning, and attention to pressure points remains crucial even when someone seems less responsive to touch. The progression of sensation changes provides valuable information about nervous system function and timeline. When sensation decreases in hands and feet only, this might indicate days to weeks of remaining function. When sensation changes extend to arms and legs, we're typically looking at days to hours. When central body areas become less responsive to touch, death usually occurs within hours. What's particularly important for comfort care is understanding that pain sensation might actually increase in some areas while decreasing in others. As nerve function becomes unpredictable, some individuals become hypersensitive to touch, movement, or pressure changes, while simultaneously losing sensation in other areas. This can create challenging comfort care situations where normal activities like repositioning or bathing might cause unexpected discomfort. The relationship between skin sensation changes and medication effectiveness is crucial for families to understand. As circulation decreases and nervous system function changes, pain medications and comfort medications might work differently than expected. Some medications might become more effective because they're not being cleared from the system normally, while others might become less effective because circulation problems prevent proper distribution. Temperature sensitivity changes are particularly significant during the dying process. Many individuals lose the ability to regulate their response to temperature changes, becoming either excessively cold or uncomfortably warm without the ability to communicate these sensations clearly. This is why careful attention to room temperature, blanket coverage, and clothing becomes so important during end-of-life care. Touch remains one of the most important comfort measures throughout the dying process, even when verbal communication becomes difficult. Research shows that gentle, loving touch continues to provide comfort and emotional connection even when other responses diminish. Understanding how sensation changes occur helps families provide appropriate touch, perhaps lighter pressure, slower movements, or focus on areas that remain more sensitive. The emotional significance of these sensation changes can't be understated. Families often feel helpless when their loved one seems less responsive to touch or comfort measures that previously worked well. But understanding that these changes reflect the body's natural process of conserving energy for vital functions can help families continue providing meaningful presence and connection. And there's one final skin sign that appears in the very last stages that almost no family recognizes, but it could help you understand exactly what's happening in those final precious hours. The final skin changes that occur in the last hours before death are perhaps the most profound yet least understood by families, involving what medical professionals call terminal skin changes that reflect the body's final transition. These changes are so specific and predictable that healthcare providers often use them to help families understand timing and prepare for the final stages of life. In the final hours to days before death, skin undergoes dramatic color changes that move beyond the mottling and cyanosis we discussed earlier. The skin develops what's called a waxy or translucent appearance, almost as if it's becoming see-through. This occurs because blood circulation has decreased so significantly that the normal pink or healthy color completely disappears, replaced by a grayish, almost ethereal quality that can be startling for families who aren't prepared. But here's what's really happening during these final changes. The body is completing its systematic shutdown, redirecting every remaining bit of energy toward maintaining brain and heart function for as long as possible. The skin, being the largest organ and one that requires significant energy for maintenance, essentially shuts down its normal functions. Cell renewal stops, circulation becomes minimal, and the skin takes on that characteristic appearance that signals the final transition. The temperature changes during this final stage become extreme and follow a very specific pattern. While the core body temperature might remain stable or even elevated, the extremities become progressively colder, starting with fingers and toes and moving systematically toward the center of the body. You can actually track the progression by feeling the temperature changes. When coolness reaches the upper arms and thighs, death typically occurs within hours. What's particularly important for families to understand is that these final skin changes are not signs of suffering or distress. They're evidence of the body's incredible wisdom in managing its final transition. The waxy, translucent appearance, the extreme temperature changes, and the complete loss of normal skin color all reflect the peaceful shutdown of non-essential systems, while vital organs continue their final work. The timing of these terminal skin changes is remarkably consistent across different types of dying processes, whether death results from cancer, heart failure, stroke, or other conditions. These final skin signs typically appear in the same sequence and timeline. This consistency helps healthcare providers and families understand what to expect and how to provide appropriate comfort and presence during these precious final hours. For families, recognizing these terminal skin changes can provide both preparation and peace. Instead of being frightened by the dramatic appearance changes, understanding that they represent the body's natural and peaceful transition can help families focus on being present, saying important words, and providing loving presence during life's final chapter. The medical community has studied these terminal skin changes extensively, and research consistently shows that they occur as part of the body's natural dying process, not as a result of pain or distress. This knowledge can help families feel more peaceful about what they're witnessing and focus on the emotional and spiritual aspects of saying goodbye, rather than worry about physical appearance changes. If you've stayed with me through this entire explanation, you now have knowledge that most families never receive until it's too late to be helpful. Please make sure to like this video and subscribe to this channel if this information could help others in your community, because understanding these signs can transform fear into knowledge and panic into peaceful preparation. But there's something even deeper happening during the dying process that goes beyond what we can see on the skin's surface. The integration of all these skin signs creates a complete picture that can help families navigate end-of-life decisions with knowledge, preparation, and peace. When you understand how mottling, color changes, temperature variations, texture changes, bruising patterns, sensation changes, and terminal skin signs work together, you have a roadmap that can guide you through one of life's most challenging experiences with greater confidence and understanding. Each skin sign we've discussed represents a different aspect of the dying process. Mottling shows us circulation changes, cyanosis reveals oxygen levels, temperature changes indicate energy conservation, texture changes reflect organ function, bruising patterns show us blood system status, sensation changes tell us about nervous system function, and terminal changes mark the final transition. When these signs appear together, they create a comprehensive picture of what's happening inside the body. But here's the most important thing families need to understand. These skin signs don't just predict death. They can help guide better care decisions throughout the entire process. Early recognition of mottling might prompt medical evaluation that could extend life or improve comfort. Understanding cyanosis can help families make informed decisions about oxygen therapy or positioning. Recognizing temperature changes can improve comfort care through appropriate blanket and room temperature management. The timeline that these skin signs provide is invaluable for families trying to make decisions about gathering loved ones, having important conversations, or adjusting care goals. When you understand that certain combinations of skin signs indicate days versus hours of remaining life, you can make more informed decisions about how to spend precious remaining time together. What's equally important is understanding what these skin signs tell us about comfort and pain levels. Contrary to what many families fear, most of these skin changes occur as part of the body's natural process of shutting down non-essential functions to conserve energy for vital organs. They typically don't indicate pain or suffering, but rather represent the body's intelligent management of its final transition. For healthcare providers working with families, understanding these skin signs can improve communication about prognosis, timeline, and care planning. Instead of vague statements about being sick, specific observations about skin changes can help families understand exactly what's happening and what to expect next. This knowledge empowers families to make informed decisions about care goals, comfort measures, and end-of-life planning. The emotional impact of having this knowledge cannot be understated. Families who understand what they're seeing can focus on providing presence, love, and meaningful connection rather than being overwhelmed by fear about physical changes they don't understand. Knowledge brings peace, and peace allows for more meaningful end-of-life experiences for everyone involved. As we conclude this comprehensive exploration of skin signs during the dying process, remember that this knowledge represents decades of medical research and clinical observation. Every detail I've shared with you today comes from evidence-based medicine and represents real, practical information that can help you provide better care for your loved ones. The human body's final transition is one of the most profound processes in nature, and the skin tells us the complete story if we know how to read its language. With this knowledge, you're now equipped to recognize, understand, and respond appropriately to the signs that appear when death approaches, transforming what might otherwise be fear and confusion into informed preparation and peaceful presence. But what happens to the other organs during this same process reveals even more remarkable secrets about how our bodies prepare for their final journey, and that's exactly what we'll explore in our next video, where I'll reveal the hidden signs that appear in the eyes during the dying process that even most healthcare providers miss.